To those who've joined us from the other side of the world, and good evening to those who may have joined us from Europe or from Asia. Thank you very much for joining. A very warm welcome to all of you for the webinar on equity and inclusion in transit, being organized by Global Mass Transit and Cubic Transportation Systems. Thank you very much for joining on time. We really appreciate your being here. We have a fantastic lineup of speakers. A warm welcome to all our speakers. The session will be moderated by Bonnie Crawford, who is Vice President and General Manager UMO at Cubic Transportation. And now I hand over the virtual floor to Bonnie. Over to you, Bonnie.
Thank you, Namrata, and good morning and good afternoon, everyone. I'm super excited to be joined by this amazing panel. I'm going to go ahead and do some introductions, and then we're going to get right into this important discussion on equity and inclusion in transit. So as Namrata said, I'm Bonnie Crawford. I'm the Vice President and General Manager of UMO. UMO is the new mobility business that Cubic Transportation Systems built around a SaaS offering, and we're very excited to be hosting this webinar on equity and inclusion. Today, I am joined by Amanda Denham. Amanda is the Director of Support Services for San Diego Metropolitan Transit System. Welcome, Amanda. We have Sheri Dixon, Director of Revenue, Hampton Roads Transit. A side note, as I'm sure you saw in the chat, Sheri is writing her doctoral dissertation on equity and inequity in transit. So a lot of interesting things to talk about there. We have Kyle Holland. Kyle is the Senior Director of Special Projects for TAP Technologies at LA Metro. Carol Kuester. Carol is the Director of Electronic Payments with the Metropolitan Transportation Commission out of the Bay Area. We have Paige West. Paige is the Planning and Strategic Programs Manager for Rogue Valley Transportation District and a fellow Oregonian. Welcome, Paige. And we have Dr. Alessandra Wall, a coach, psychologist, speaker, and founder of Noteworthy, who will be joining us for the outside perspective on equity and inclusion. Good morning, ladies, and welcome. I'm very excited to be hosting this panel. I do want to kick off with a little bit of a disclaimer. We have a really diverse and all-female panel, which is fantastic and exciting to see. I do think as we talk about equity and inclusion in transit, it's really important to highlight that each of us as panelists do have the privilege of being banked and not perhaps being in the socioeconomic class that often is a challenge for equity and inclusion for riders in public transit. But we do, of course, have unique perspectives on many of the things that we're going to be talking about. And I suspect that there are several of us who may have grown up in different socioeconomic classes and have that experience of perhaps, at least I remember gathering, bottles and cans in college to be able to, pay my bus fare and pay for college at the same time. So I'm sure we all have our own perspectives that we're going to be able to bring to the discussion. And I'm going to kick it off with really a foundational question for the group. What does equity and inclusion mean to you personally and to you or your agency? And I'd like to go ahead and start with Carol. If you could talk a little bit about what this means to you personally, and then we'll just do a little round robin, and then this is really an open dialogue. Also, for the people that are joining us, please feel free to post your questions to the chat as well, and I'll filter some of those into the discussion as we talk about this important subject. Over to you, Carol.
Great, thank you. Wonderful to be here today. And yes, it's a privilege to work on this important topic. I guess I'll just say a couple words about what equity and inclusion mean to me. I'll say that, first of all, I am an urban planner by training, and I studied at the Graduate School of Planning in Los Angeles, which is one of the most diverse counties in the entire country. So I'm glad we have Kyle here to talk about what they're doing at the Phenomenal TAP program. But I say that also because I guess as a professional working in transit and transportation and delivering programs to the public, I always took a lot of solace in the fact that we were very, very cognizant of designing programs for people with disabilities at all income levels, banked or unbanked. And that's a really huge challenge that the Ubers and the Lyfts of the world don't necessarily have to tackle first and foremost, but we do. And while it is a challenge, it's one that I have always really felt good about. And that kept me going long enough in my career until we got a new executive director, Therese McMillan, who actually had previously been under Phil Washington at LA Metro. And when she came into her position a couple of years ago, she worked with our commission so that we now have an adopted equity and inclusion policy at our agency. And I would say that policy challenges all of us to go just a little bit further because it commits to meaningfully reversing disparities. So that's different than making sure we're serving every member of the public with our publicly funded Clipper program or our toll payment programs. And I think I'll just say that we are grappling with what that means. And that while it's wonderful to have an adopted vision statement, unless we operationalize that vision, we're falling short. And as I think probably everybody on this call knows, the devil is in the details, and we have a lot to learn and we have a lot of work to do. So I'll just leave it there. It's obviously as a public servant, I mean, I know that's been a term that's been demeaned at times, but I think it's one that really that I'm proud to hold, and I'm really pleased that we're setting ourselves these tough tasks.
Thank you so much, Carol. And I think that's a great way to kick us off. I'm going to go next to Amanda. Amanda, can you talk a little bit about what equity and inclusion means to you and to San Diego MTS?
Good morning, and thank you for having me here, Bonnie. Carol, I think you spoke to a couple really important points about what we do in public transit in the unique field that we sit in, and that we are public servants, and we are here to, at core, provide key and essential service to our communities. And so one of the things that's really resonated with MTS and where we're really looking to integrate throughout everything we're doing now is who is that community? Who is our public? San Diego obviously sits in a bit of a unique position, both geographically and policy-wise. We share one of the largest land border crossings with Mexico, and 55% of the people who come across that border use our system. And so when we're thinking about equity and inclusion and diversity, San Diego really needs to think about how we reach everyone, whether they're here or across the border, whether they're banked or unbanked, which is something that absolutely impacts the decision-making, the policies that we make here at MTS. We're doing things, we haven't gone quite as far as MTC yet of adopting a full policy, but instead we're really looking at where can we take all of our existing policies and make modifications to make sure that there is components of equity and inclusion as part of all of them. Looking at things like kicking off an RFP for a social listening tour, where we're actually hiring firms to help us really get into the weeds with who our communities are, taking it that step further from the advocates who are always going to be at the forefront and going past them to see who are the community members and what is it they really need MTS as a public servant to provide them.
I love that. And Amanda, one thing you mentioned with the shared border crossing with Mexico, one aspect of equity and inclusion that I don't think often gets discussed in the unbanked, underbanked equity for people with mobility challenges, it's also that language barrier. It's being able to provide tools and services to people who perhaps don't have English as their primary language that's spoken at home. And so that's something, and I'm going to go to Kyle next, that I know that LA Metro has definitely put a focus on ensuring that they're serving the communities with all of the different languages that are spoken. Kyle, can you introduce what equity and inclusion means to you and to LA Metro?
Sure. Hi, everyone. I'm excited to be here. Thank you for having me. Equity and inclusion has been a hot topic at Metro for a long time. So Metro believes that access to opportunity should really be at the center of decision making. And so, as we all know here, transportation is essential to enabling that access, whether it be access to jobs, healthcare, education, just to and from home or work. So, when it comes to our infrastructure, the programs that we offer, the services that we offer, it's been really important to us to target those who need us the most in order to sit back and say that we're actually improving the access to opportunity for all. And so a couple of years ago, Metro hired a chief equity officer, and that has been very instrumental in terms of taking that vision, taking that interest, and really folding it into our work and our planning. And so one of the things that we have is an equity tool that we use to measure every single big project that's underway. Even in the planning stages, it's not good enough to do it at the very end, right before you launch it to the public. It has to be folded in and really embedded into the thinking and the decision-making behind the project. So for me personally, I sort of take that challenge, I take that responsibility to fold that into my work and to utilize the equity tools that I'm given. In terms of our TAP technology, I've been with TAP for 7 years. It's been really great to see how we've been able to leverage our technology in a way that supports a lot of these initiatives to be inclusive and especially with the unbanked and for persons with disabilities and things like that. So it's been challenging, but it's work that feels really good. And so we're excited to keep doing it.
That's awesome. Thank you so much for that perspective, Kyle. I'm going to go now to Paige. Paige is with Rogue Valley Transit District, serving Southern Oregon. Paige, what does equity and inclusion mean in Rogue Valley?
Yes, hi, good morning. So Paige West, Rogue Valley Transit. Thanks for having me, Bonnie. I'm still learning a lot about this topic and trying to understand how we can further our goals here at Rogue Valley Transit. We do have a massive amount of data. I think we all realize that the amount of data that we can collect is really just on the surface. And I love the idea that Amanda said about doing, these listening groups where you're going further than the stakeholders. And I think that's always a challenge, is to not go to the key gatekeeper of populations, but to try and go further. And that's especially in the last 2 years been extremely challenging to be able to identify and have that opportunity to speak with others that are struggling with COVID. At the same time, though, I think that having these types of sessions like we are today and being able to do the digital platforms and meetings and having 226 participants on this kind of a call is also just an amazing opportunity for us to get together and hear from others. So I think we are in an interesting time right now, but we also need to look at the silver lining that this last 2 years has really given us a challenge, but also an opportunity to be able to bring more people in. I think for me, when we do look at how do we include people, it's more than just an interview, and it's more than sitting around a table, but we need to make sure that the diverse interests in any of our planning and projects allow people to feel like they belong, that they are respected, and that they have a worthwhile hour or two to provide us with the information that we can then use, hopefully, to implement new projects. It's one thing to attend a meeting and sit there silently and not say a word, and for us planners or directors to just check a box and say, yes, they attended. But I think what we really need to do is make sure that we are going further than that and ensuring that we're listening, even if there's an awkward silence, even if there's information that is somewhat confrontational, to hear, because we need to listen and we need to get past those barriers and have people feel comfortable enough to be able to express the things that they need in their lives. The other thing is that I think that this goes beyond race, and it goes beyond gender, and it goes beyond age. There's a big project going right now in Oregon, climate friendly, equitable communities, and I'm sitting on the rulemaking advisory committee for that. And it was interesting to hear the definitions of what they're considering disadvantaged populations, and they're going as far as a single parent that has challenges, no matter their age, right, their ethnicity. But we all know, I've been a single parent myself. It's hard, and they have different challenges than married couples with children. Also, people who hold 2 or 3 part-time jobs just to be able to make ends meet. That's a disadvantaged population. Again, beyond gender, beyond race. I think that the idea of encompassing what is a disadvantaged population has really grown over these past few years. And those are all different interests, and they all have their own challenges. They do often meet somewhere in the middle of how we can address those challenges, but we are learning so much about how these populations are living and not being able to, or being able to access transportation.
That's a great perspective, Paige, and one that I think our doctoral dissertation writer, Miss Dixon, probably has some thoughts on. Sheri, representing Hampton Roads Transit. Sheri, do you want to talk a little bit about what equity means at Hampton Roads, and then also, I think, just tagging into to what Paige talked about. So much of equity and inclusion typically is focused on the banking status, the race, the gender, the age, but really expanding it out to some of those other communities. So we'll turn it over to Sheri, and then pass it over to Dr. Wall here following that. Sheri?
Awesome. No, I don't want to talk about any of it. So no, I'm just kidding. I love to talk, so get ready. I hope everybody, went to the bathroom. So here we go. So as she said, my dissertation is on inequalities and inequity in public transit. I just kind of stumbled into it. I don't know how, but now all of a sudden I'm the equity queen. So your first question was, what is equity and inclusion to me or to us at Hampton Roads Transit? I think the inclusion part is the easy part. It's easy to define. It just means everybody, right? We just include everybody. The equity part is what the difficult part is, because most people confuse equality with equity. And so I'm always saying, equality, it gives everybody the same, but what we need is equity. And you give everybody what they need, based on what they need. So they're not getting the same. And that's where the difficulty comes in, right? So at Hampton Roads, the majority of our riders are bus riders. So we have bus, paratransit, light rail, ferry, trolleys, but the majority of our ridership comes from bus. And those riders are lower income African-American individuals. It is the lower income minority population here. So being the revenue person, I see the reports, and I think that's how I kind of got into this. How many times do our bus drivers have to hit the short key? So if you're thinking about it, somebody getting on and they're paying $2 every time they get on, but they don't have $2. They got $1.67, and we have to hit the short key. We let them ride. So, once you're seeing all of these short key hits, it makes you think, well, okay, well, what is wrong that we have all these riders and they can't afford the $2, right? And we also at Hampton Roads we don't have, smart cards. We don't have mobile. We did do a pilot in Virginia Beach. So we really don't have the ability to do any type of fare capping. We don't have a rewards program. So there's a huge inequity for our lower income riders because they can't take benefits of buying the multi-day tickets. If they can only afford the $2, they're paying $2 every time they get on. So that's really my focus for us, because that's who our riders are. So in my research, I noticed that a lot of people are looking at a lot of these percentages that are thrown out, which it's great information, but it's only as good as it relates to your demographic or your region. And a lot of people take numbers at face value. So I have a master's in accounting and tax, so I am a numbers person, but then getting a PhD in public policy and public administration obviously is a stretch. It's been a little difficult, but it helps me really look at the numbers that I think a lot of people aren't looking at. So when the FDIC comes out and says, oh, we have a 5.4% unbanked population, everybody kind of goes, oh, it's only 5.4%. That's not that big of a deal, right? Listen, I said it at APTA, if it was a pair of shoes and it was only 5.4% off, I wouldn't care. I'd be like, I'm still not going to buy them, right? We don't think it's a lot. But when you drill down into that, and I did some amazing maps if anyone would like to see them, if you drill down into that 5.4%, it shows you what your demographic is. So maybe up in North Dakota, it's not that bad, but down in Hampton Roads, that 5.4 looks more like 20% or 25%. And then if you throw in minority, that percentage continues to go up. So that 5.4% now triples for us when I drill down into it. And I really look at who my riders are. So I don't want to look at the whole population because, as we all know, not everybody rides transit. But more importantly, not everyone is dependent on transit. So I want to see what that population is on those who are riding our transit. And the majority of bus riders are lower income minority individuals. So for me, the equity portion is what I think a lot of transit agencies will say, oh yeah, we provide equitable services. But if something comes along, we're adding a new service or we're adding a new piece of technology, all of a sudden we realize, wait, maybe we're not providing as equitable services as we thought we were. And so that's where I'm trying to educate people on really questioning, are you really providing equitable services? If you were to take away cash, would you create a huge inequity for, like you said, vulnerable populations, that single mom who's just trying to get on the bus, get her kids to daycare, but now she's got to go to a 7-Eleven because the bus doesn't take cash anymore. And she's got to haul her 2 kids and it's snowing and she's got to walk uphill both ways. Those are the kind of things that we need to think about. I also challenged at APTA, it's great if I know my demographic, but I think the vendors who are coming to sell me, mobile ticketing or smart cards or new technology, I think you should know my demographic too, because you're the expert in your technology and you should know what I need. So I feel like you should also know my demographic. I'm going to stop there because, as Bonnie knows, I can go.
Sheri gave us a preview of her dissertation at APTA last week, and I know we all that were there appreciate it. I wanted to go over to Dr. Alessandra Wall for the outside perspective on equity and how some of the things that our panelists have highlighted. What does equity and inclusion mean to you, Alessandra, and how do you see the broader community impact when you think about how we're addressing equity and inclusion for transit?
So I'm always honored to be like the non-industry person on industry panels, and it happens frequently enough that it's fun. And this morning I was thinking about this question, right? What is equity and inclusion, and what does it mean in transit? So I just want to give a teeny bit of background. My background is as a clinical psychologist, so I'm going to tie this to people coming into the ER and needing to have access to services and be able to get to that ER. But also when we discharge them from the psych ER, how do they get back home? I want to tie this to the fact that I actually wasn't born in the States. I was born in the Middle East, but I was raised for the majority of my life right outside of Paris. And so I was very, very lucky. We have extremely good public transportation systems. And because of the social systems in France, I mean, it's paid through taxes, right? It's not free, but there are a lot of subsidies for families to be able to access public transportation. So probably from the time I was 10, I was taking the subway. By the time I was 11, I was taking the subway and 2 buses to get to school and back, which allowed my mother and my father to be able to go access jobs. My son today has to walk 4.5 miles back home every day. He can suck it up. It is fine. It is good. It builds character. But part of that is because the public transportation system here, I live in San Diego, it's budding. There's so much we can do to expand it, right? And so when I think about now, when I go back, I've used the metro and the extended railway and the bus system in Paris. I've done it in New York. I've done it in Boston. I lived in Boston for a while. I've done it in London. There was one more city I was thinking of. But, you know, now when I go back into public transportation, I realize the gift that it is, right? There's an incredible freedom for a child, for a parent of that child, for individuals who can't afford cars. If we're thinking about the environment, for people who don't want to own vehicles, to be able to move around in a space freely and to be able to move around safely. So when I was trying to think about, you know, what does equity and inclusion look like in transit, for me it breaks down into two categories. One is accessibility, which is actually a broad category. I'll get back to that. And as a woman, the other piece is safety, because we probably don't need it in this place, but I have more stories that I probably should have to share about being a girl and then a woman in public transportation in very unsafe situations. And I'm lucky because I can hold my own. But I know there was a period where I told my parents I was taking the train and said I was getting up really early to walk the train line because I didn't feel safe taking the train to school because of an incident that happened in the train. And that was the first of many, right? So when we think about accessibility, what I'm thinking about is accessibility on three levels. One is, do we create transportation networks that help the people who need to use or who want to use those transportation networks actually get from where they are to where they need to go, right? Sometimes you're in places where, sure, there's a public transportation system, but it's going to take you 2 hours to do a trajectory that would have taken you 15 or 20 minutes in a car if you had access to a car. And the impact that that has on an individual, on a family, on your mental health, the loss of sleep, the loss of time, the loss of quality time in a family, your inability to be there for your children, or to caretake for anything else, a pet, another human, yourself, is huge. Then there's the other piece of accessibility. Can you navigate the system itself? Meaning, as an individual, when you enter, is the system user-friendly? Can anybody figure out how to buy a ticket? I'm not entirely sure how to buy a ticket here in San Diego. So Amanda, I'm in Little Italy. I'm right next to I'm by one of the central stops. Please come and show me how to buy a ticket. Some lady asked me on the platform the other day, and I looked at the machine and I'm like, three countries, 5 big cities. I can't figure it out, right? And I'm like, we're pretty good with this. Like, it's not the PhD. It's like I've navigated the world and I feel a little intimidated, right? And that idea of, can I approach a system and understand how to use it? I think we need to tap into McDonald's because they've made that really simple. So maybe they can explain to us how to do that for things. And then the other one that all of you have brought up is the question of financial accessibility, right? So I'm very fortunate. I can afford public transportation, but Sheri, you were throwing out that $2. I'm like, oh my goodness, that is so much money. I think of when I started as a psychologist and we were seeing community people and I was still a graduate student at the time, and we would tell people, pay us anything you can, right? So literally sometimes people would pay me 10 cents, 50 cents for a session, and I would get those in pennies. That is what they could scrounge up. I have no idea how they got to me, right? Maybe that's where the other 50 cents to $1.50 went, was taking the public. I was in Dallas, so taking the bus to get to me to be able to come to the session. So those pieces of accessibility, which is really broad. And then the second piece is safety. Can I get onto a train, a bus, a trolley, a tramway? And as a human being, as a child, as an elderly person, as a woman, as a minority representative of any group, feel like I can board that transportation system and I can get to where I want to go safely without harassment, right? Without having to be anxious in that space. Like, that is really the way I think I look at and think about it. And when we're talking about how to access that in a system, I love, and I wrote a note in the chat about we need to be surveying the people who are using the system, but we also need those people actually in the companies, right? So your organizations, that's where we talk about, equity and inclusion from the organizational perspective, need to be hiring and need to have spaces to hire and have the psychological safety, the inclusion piece, right? The voice heard from a really diverse group of people who can then inform the systems, the plans, and everything else.
I think you brought up some really great points, Dr. Wall and Carol. I want to pass the next question over to you. One of the things that I know that MTC has really been focusing on is how to address some of those equity challenges with some of the unique programs that you've put together. Can you talk to the panel and to the attendees a little bit about the programs that you've established and how you feel that those differ for solving some of these inequities and really bringing the riders across the dozens of agencies that the Bay Area and the MTC serves into the transit system in a safe and equitable manner?
Well, sure. Maybe I'll just, in the interest of time and brevity, focus on our Clipper Start program. So Clipper is our smart card fare payment system in the San Francisco Bay Area. It's available for use on all of our more than 24 transit agencies. So that's been quite a coordination enhancement and transit improvement just at the basic level, that you can fund one card and use it to get on buses, trains, ferries without having to worry too much about having different kinds of fare media or having to interact with those pesky TVMs that literally no one likes. There really is always a little bit of friction as users figure out how to ride transit and how to pay for transit. Of course, we'd like it to be none, and we can talk about some of the things that we're doing to really lessen that friction. But frankly, for people to whom we want to offer discounts, well, I'll just say there's a little bit of a trade-off between, say, for example, accepting a contactless credit and debit card at a fare gate, which is arguably very frictionless, but offering discounts via that kind of mechanism is challenging. So let me get back to Clipper Start. Clipper Start is our new means-based transit fare payment pilot. I put the URL in the chat. It's clipperstartcard.com. It is a means-based discount offered on 21 transit agencies. So you qualify once. You receive a Clipper card that is ready to go with that discount eligibility embedded, and you then receive the relevant discount on whichever agency you might be riding. The discount's not consistent. In some cases, it's 50% off the adult fare. In some cases, it's 20% off the adult fare. But that's part of what we're looking to test here, is to see, what levels of discount provide assistance, but are also financially stable to the transit agencies. To qualify, this discount is for adults who are earning less than 200% of the federal poverty level. That is not very much money. And in fact, one of the bits of feedback that we've already received is, no one can live in the Bay Area on $53,000 for a household of 4. But that's where we started. And again, it was a delicate dance of figuring out how to be helpful, especially, and this was very timely in kind of a post-COVID recovery era. But anyway, trying to figure out how to offer this means-based discount, but also sort of not offer such an attractive, such a generous discount that transit agencies who rely heavily on fare box revenue are somehow impacted. So to date, we have had about 8,000 applicants. We've screened some folks out. We've screened about 8,000 in. Most of those folks are taking rides on our biggest operators, on the regional rail system BART and on San Francisco's system Muni. More than 50% of the applicants are female. About 15% report that they have no income. Most applicants are Asian, and of the rides taken, it looks like about 44% so far have been taken by Asian riders and about 50% by Latinx riders. So we're at the early stages here gathering, gathering data. I will say we worked extensively with community-based organizations to promote this program. It is, I think someone made the comment earlier on about, not assuming that we know either what the challenges are, how the program should be properly designed, or how to do outreach to some of the communities that we're hoping to reach. And so we really did make an effort to reach out to community-based organizations. We designed an online application that can either be done by an individual or by an organization on behalf of an individual. What else can I say about Clipper Start? Let's see. We have a very extensive evaluation underway. So we are really looking at, are we making good on our equity pillars? Are we listening and learning? Are we training and growing? And I can absolutely tell you that we are learning lessons along the way. And again, the devil is in the details. I'd be happy to give a couple examples. Should I give one example real quick, Bonnie?
Yeah,
okay.
Absolutely.
For example, and this is actually related to a slightly different equity program that we're working on related to express lanes. We recently did some qualitative focus group work. And as many of you probably know, recruiting for those kinds of focus groups where you're looking for someone who either rides transit and uses a special Clipper card to do it, or someone who rides a particular freeway and uses a particular portion of that freeway. It's hard to recruit those folks to begin with. At our agency, we have a requirement for including different limited English proficiency populations. And so we recruited according to those guidelines. And this was for a bit of research going on related to the 880 freeway, which runs right through Oakland. So we did the focus groups, met our requirements, came back, we're reporting out on the findings to our Policy Advisory Council. And we got some pretty tough feedback. It turns out that because we, as sort of a byproduct of having included limited English speakers in Asian households and limited English speakers in Hispanic households, we had very few Black folks represented in this qualitative research. And 880 runs right through Oakland. So we faced some tough questions about why didn't you have more Black people in your research? And so we're working through that. I think we're going to be doing a little bit of follow-up work, but it's a rich topic because, of course, the goal is to do research that represents affected communities. I think sometimes the data can conflict with perception. And then again, with something like qualitative research, where you're dealing with, dozens, not thousands of people in your work, being able to really make good on representation is very tough. For example, we also recruited unhoused people in some of these focus groups, and in both cases, they didn't attend. So a small example related to kind of the research side that just, I think, points up some of the challenges of trying to be everything to everyone, trying to, balance competing interests. Ultimately, when you're delivering a program, there are some pragmatics and some choices to be made. So anyway, I'll just leave you with that one example. Happy to talk more about how Clipper Start is working, though.
That's a great example. One follow-up that came up in the chat, Carol, is why was 200% of the poverty line chosen, and how does that align with Title VI? And for those that maybe aren't familiar, if you want to describe Title VI as well.
Really, I get to be the Title VI expert here? Okay, I'm going to go.
I can if you like. It's a federal statute that requires that you provide equitable solutions, especially if you're getting FTA funding for anyone that's not specifically oriented. And it can be a challenge for, especially for technology programs, trying to find that happy balance between ensuring that you're providing equitable solutions for transit riders who maybe don't have a mobile device, maybe are unbanked or underbanked. And it's why programs like Clipper Start and others, have come into being to try to find that balance. To ensure
I guess
that
too, Bonnie, the
so,
way that we encounter Title VI is that when agencies make fare changes, they're required to go through an analysis to make sure there's no disparate impacts on underserved communities. On the 200% of poverty level, I would say it was in discussion. So it was in discussion with the transit operators. I mean, we were definitely looking to rely on some kind of existing standard. I will say that's a piece of feedback that we get very often. The question of, well, why doesn't Clipper just rely on CalFresh or other social service programs that already exist in the state of California? Why don't you just coordinate in that way? Set that question aside, but there are existing standards. So I think there was a desire to key off of the federal poverty level. Just it's a known quantity. And 200% was kind of pegged, as I said, to try to, for the purposes of this pilot, find that sweet spot that would offer an actual benefit, but also be somewhat measured. So I think that is that's a multiplier that we could potentially be adjusting in the future.
That's awesome. I know one of the programs that I learned about while I was researching the excellent women on our panel was the program that Amanda and MTS has around fare citations and this concept of not punishing people who maybe don't have the means to ride. Can you talk to us a little bit about that program, Amanda, how it came to be, some of the policies that you put into place to make that happen?
Sure. Thanks, Bonnie. Yeah, the MTS operates, as most of you do, on a fare collection basis, and we do enforcement by inspection. So ours we have an open trolley system and then bus operators who collect fares. And so traditionally, our fare evasion rate has been relatively low compared to many in the industry, right around 2.5% to 3%. And what we were finding, though, is the citations that are being issued, we don't have our own courts. And so citations issued by MTS officers were then sent on to the San Diego courts for adjudication. Oftentimes, a fine for not having a fare would start out in the range of a $75 fine. And by the time it got through the courts and the court processing fees, that fine had jumped to almost $200 for simply not being able to show a proof of a fare when riding our system. And so about a year and a half ago, we sat down with our public security committee and really wanted to look at how can we do this differently. So we did a lot of research looking at other systems, TriMet being one, LE Metro being another, to look at how other systems are better handling fare evasion and fare citations. And so we came up with this concept of a pilot to change that process. And so rather than issuing an expensive citation that goes to the court within 3 to 4 days, we wanted to do a diversion program that gives riders the opportunity to make right on having not had fare when they boarded. And so with that came the opportunity to collect a lot of additional information. Why didn't you have a fare? Was it the system? Was it the means to not be able to pay for the fare? Was it time? So we implemented a pilot in September of 2020 that allowed our riders a couple different opportunities. Number one is if you didn't have a fare when you were approached by an inspection officer, you were given the opportunity to purchase one. So whether you had the mobile application, just didn't activate your ticket, you could activate it then. If you wanted to step off the vehicle at the next stop and purchase a ticket, and then they were let to go. If they were issued the citation, though, for not having the fare, they now had options for how they actually could resolve that fare. So passengers could have up to 120 days to come to our transit store and pay us directly a $25 fine, so significantly reduced from the nearly $200 before. They were given the opportunity to dispute the fare citation. So maybe it was somebody who was using our mobile application and their phone died and they didn't have a proof of a fare, but once they got home and charged, they could show us, I did have a ticket, I just couldn't show you. And then lastly, we introduced the concept of community service as an option for somebody who doesn't have the financial means. So they could come and decide to do 3 to 4 hours of community service with several of our local organizations, and the citation would be resolved in that way. The pilot, as I said, started in September of 2020, not a great time frame to be able to introduce something new with COVID. We had just gone back to front door boarding a couple of months prior to that and ridership being where it was. So we did go back to our board this past summer and ask for an additional 12-month extension, which our board certainly agreed to do. We're using the pilot to gather, as I said, data about why. The adoption hasn't been super extensive yet, but neither have the citations given where ridership is. We also just moved to a new fare collection system this past September. And so there's a learning curve going with that. And so it's really taking our programs and our quote unquote enforcement and really looking at it as an education and going back to those core principles I talked about at the beginning of who is our community and what is the core service we're there to provide, while also kind of using the term that Carol said, it's a delicate dance. We are an agency that does rely fairly heavily on our fare box collection. Anywhere from 35 to 40% is our typical fare box collection here. So we do depend on that revenue. And so trying to find the right balance of requiring people to pay the fares that we have. We did do, when we switched to our new Pronto system for fare collection, we did do a full fare restructure. And we actually reduced the fares for our youth riders. And one of our local governments, Sandag, actually just announced a free fares for youth starting next spring. So I think we're looking at kind of all the different ways we can address some of the concerns that have been raised here about the financial access to the system. But the fare diversion program has certainly been one way that we've really tried to take it a step further and educate and make sure that we understand, what we can do from our enforcement to protect that revenue that we depend on to operate, but also being mindful of the situations that unique riders may be in. And in the pilot too, just one point to add, we've had flexibility. We've learned things already just in the first year. We've noticed that a significant portion of those who are issued citations aren't just issued one. Our highest portion of citations are issued to people who've had 4 or more citations. And so it's really trying to get in connection with those people and find out what is it that's preventing you from having a fare. We had one gentleman who came to us, he had 7 citations. Those 7 citations, having gone to court, prevented him from being able to qualify for certain levels of employment and benefits because they're in the court system. So with him, we were able to reduce it down. We looked at his situation, and instead of requiring 7 different 3-hour sessions of community service, we compromised and found a good balance that he was able to accomplish, and the citations were able to be resolved. So we're excited about kind of what the next year might show us with the pilot and expanding it and getting, again, the information out there. It is data is provided to each person when they're issued a citation about the program. So the site literally comes in an envelope that explains all of the different options in multiple languages. And so we're optimistic that as we continue through the pilot, we'll be able to, adopt some longer standing policies and modifications to our system.
I really love, and I'm so glad that you were able to highlight a lot of the details there, Amanda. I think that, specifically when you talk about a citation that goes to the courts and the courts then add fees, and you get into this vicious cycle where a person might have gotten a citation because they couldn't afford, as Sheri was saying, the $2 fare. So they're going to pay the $1.50 or the, the $1 that they might have on them, so they can also pay for their, psychiatric session, or so that they can, buy the box of macaroni and cheese to feed their family that particular day. And when you work with those community organizations to give them an alternative path, I feel like, and there are a few questions in the chat that you'll probably want to respond to, but it's such a great way to meet people where they are. And to recognize that ultimately, as transit agencies, as technology providers for transit agencies, as riders ourselves, we really want people to have the ability to just get on transit, right? For the environmental benefits, for the time savings, for the ability to socialize and have, time to do homework, to think, to listen to music, catch up on a podcast, save time where you're not, sitting in, congested freeway. All of those things are really good and meaningful. And the more we take away those barriers, the better off all of our riders will be to get back onto transit. I want to go to Kyle for a discussion around, one of the things that came up in the chat was around how you're handling those that are unhoused, who are utilizing the system. And I know that LA Metro and the TAP has been looking at some ways to really identify and work with different populations that are using the system. Can you talk a little bit, Kyle, about some of the initiatives that you're doing with LA Metro, and if you have some specific goals of how you're trying to work with the community that may not be housed?
Yeah, for sure. So recently we've launched a Fearless initiative where we've been working with high schools and schools in LA County to offer what we're calling the Go Pass, which is a free pass for students. 70% of public school students in LA right now are low income, and many of those are unhoused as well. And so working with the schools to come up with a funding mechanism to where that student can ride for free and not worry about how they're going to get to school, if they're going to get to school safely. So that's been well underway. We recently launched it. It's a growing program, but we have seen a lot of success so far. We've also made a lot of improvements to our LIFE program. Our LIFE program is specifically for low-income households. And we've made it easier for them to apply for the program and to qualify for those deep discounts. With the homeless community specifically, I would say about 4 or 5 years ago, Metro at an agency level did a lot to shift the narrative around homeless communities. Instead of just booting them off the bus or booting them off the train or treating them like they aren't even humans, we did a lot to partner with City Year and other organizations to provide that homeless person with services that they may need and to actually escort them to those services if they wanted to. So that was a big step in the right direction for our agency. And the homeless population is a tricky one because, we conduct several surveys, customer surveys each year. And when we're trying to identify the pain points of our riders, a lot of them point to the homelessness issue that we have. And that issue keeps growing because it's growing in LA with housing prices where they are. There's more people who are living in their cars or living on the streets. And so one of the things that we did a couple of years ago was we started to work with, we have about 80 homeless agencies that we work with, who provide those direct services to homeless communities. And so we started working with them to understand the needs of those groups, their travel patterns, how many times per week, for example, they're traveling, and how we can come up with free fare programs or deeply reduced programs for those agencies to pass those benefits on to the homeless community. So it's definitely important. It is a group that is always on the side that probably needs us the most. And so we've done a lot to include them and to make them and to figure out how homeless individuals and families and, other groups of riders can coexist on our system without there being any issues or concerns.
That's awesome, Kyle. And it sounds like some really good programs. I know there's been some discussion in the chat as well about some of the UPass programs and youth programs. Hearing from the Bay Area and San Diego and LA, all very large systems that have a lot of interoperability. I want to go to Paige for a moment for one of the questions that we've had in the chat about how you're building equitable routes when perhaps you're serving more rural communities where you may not have a high number of riders, but you still need to provide that connection to some of those essential services like the hospitals and the medical services, the schools that are in the community. Can you talk a little bit, Paige, about your approach at Rogue Valley to building equitable routes from a planning perspective?
Yeah, absolutely. I think at the surface, that question seems like it's easy to answer, but it's really not easy to do in practice. So you're right. We do have a small urban system here. We're about 180,000 in population. We have 8 cities that we serve, and our total transit mileage is, I think it's 74 direct miles for those of you planners out there. So very, very long routes. We've had a practice for, the 40 years that we've been in service to make sure that we are providing at least a basic level of service, and that would be 60-minute headways to cities as small as Jacksonville, Oregon, which is only about 2,500 in population. It's actually in our charter and bylaws when we were formed by the state of Oregon to ensure that we continue providing a basic level of service, and it's only fair. The folks that live in that community are also paying property taxes. So, they're paying for a service. We need to make sure that we're providing it for them. But some of the other things that we've done is, before the recession, I've been working here for 18 years, so I've lived through that recession. But before the recession in 2008, we actually were starting to look at doing higher frequency routes and taking service that might have been at 30 minutes and bringing it up to 15-minute headways at the loss, honestly, of those other smaller communities and keeping them down at 60-minute headways. When the recession happened, we really quickly realized that that was not going to be the best type of service for our community, with people who are now paying $5 a gallon for gas. Remember that? $5 a gallon. That was crazy. They were losing their jobs and they were unable to get to work. And so our board and our management quickly changed direction and said, instead of us increasing service on these routes to attract what we call choice riders, we were going to provide more service into all of our communities to make sure that we can capture anyone who needs a ride to get to work or to get to school. And that was our priority. And it's actually continued to be that mission since then as well. But I think I want to talk a little bit about something that is perhaps different when I look at providing service. When we are going to make a major purchase for, let's say, a new CAD AVL system, or a new fare collection system, or electric buses, these are all in many ways multi-million-dollar projects. And every time I look at those contracts and those procurement processes, the first thing I think of is how much service is that going to take away from the community for RVTD to be able to pay for those big capital items. Because let's be honest, we don't absolutely need electric buses. It's great for the efforts of reducing our greenhouse gases, but if it's going to take away 2 or 3 of the routes in my service system to be able to accomplish that goal, we're not quite there yet. So when we are looking at doing electrification, and we're actually looking at buying 7 buses in 2025. It's a very strategic methodology that we're trying to do so that it doesn't take away from service. Same with CAD EVL. We've got a pretty big project that came in, and I had varying bids from $400,000 to $1.2 million. That's a vast range in a contract. And it equates to how much service is that going to take away in those future years for us to be able to purchase and install that equipment? And does it actually pretty much meet the needs if we go with that system that's $500,000, so that we don't jeopardize the services in the community? So I see a lot in the chat about electric buses, and believe me, I'm a supporter of that technology. But I think the general community pushes on transit agencies to go electric really fast. And the honest reality is that sometimes we don't want to do that simply because it would take away service from the community. And that to me is an equity issue. Service is what we're here for. We're here to provide that service. And if it's going to mean a diesel bus or a CNG bus is providing that service, and it's allowing someone to get to work, to get to school, to take their kids to daycare, that to me is more important right now than doubling up on our capital budget so that we don't provide the service at all.
That is an excellent point, and one, quite honestly, that I hadn't really thought about or internalized. Carol, you have your hand up. What would you like?
Well, I wanted to underscore what Paige said. When we talk to transit riders, our policy boards are like, how come you don't have the most cool app to pay with, which we now do. But you go talk to riders and they're like, what I really need? I need the bus to come. I need reliable service. And I'd love a discount. Like, can you give me a discount? But what's the point of a discount if the service isn't there? So to the people who are saying things like, hey, why not just go free fare? I would argue that's really not the most equitable. And in fact, why don't we take a look at the discounts that we automatically offer to wealthier elderly people, for example? So in the case of free fares, some of our transit agencies in our region rely very heavily on income from the fare box. So less fare box income, Paige is right, less service. I also just wanted to give an example, an equity example from the Oakland DOT that I think is fascinating, because I think Paige made the point, you can't meet all these goals at the same time. You're going to have to take from somewhere to give to somewhere. And the city of Oakland has really, in their paving program, been so bold as to tell the historically privileged hillside communities, we're not paving your potholes right now because we are busy down in the flatlands, historically underserved, and that's where the resources are going right now. And they're taking the flack for that. That is, I think, a very bold position. I think that's what we're all saying when we say we want to have and deliver on an equity platform. But I got to applaud the city of Oakland for really going for it, because standing up to moneyed, privileged interests is never going to be easy.
Thank you, Carol. And thank you and Paige for that insight. Really, I'm going to go to Sheri next, because I think that especially when you get into systems that are really broad and serving either a very regionally dispersed population, you're serving a lot of different equity classes, whether it's the wealthy vacationers that are going to Virginia Beach, or that are perhaps living in sort of the Medford Ashland area, in Paige's service area, or whether you're in a much more rural area. People just want the bus or the train to get there. They want to know that it's reliable and that the experience is going to be seamless, so that they don't show up late to their job, which costs them a shift, which then costs them the ability to feed their kids that day or that week, or keep the lights on, or have reliable cell phone service. So Sheri, from your perspective in Hampton Roads, where you've got such a diversity of services serving so many communities, maybe tacking on to Paige and Carol's discussion about service, would be great to hear from you about sort of balancing that.
Sure. So in Hampton Roads, we service 6 different cities. So we are very widespread. And like I said, we do have trolleys in our Virginia Beach location, which we only run during the summer season. We have ferries, light rail, and then our buses. So whenever we're talking about technology, or we're talking about issues with equity or cash or removing cash or something along those lines, I keep trying to pound it in people's head that you can't look at a transit agency overall. You have to look at it by mode, because I don't care if you're here or in LA or DC or, in some little town, I don't know, in Oklahoma. Different modes attract different people. Just like, people in businesses, when you ask for more tax money, they want the new shiny light rails. Everybody wants that, but nobody wants to put money into our buses, which is what the majority of people ride. So whenever we're looking at new technologies, I always say, well, what are we talking about? Are we talking about our buses, or are we talking about our trolleys? Because those are very 2 different demographics. The people who come into Virginia Beach who ride our trolleys, they're on vacation, they're banked, they have money, they've got a hotel. Those are different from the people who are riding our bus. The people who ride our ferries and our light rail tend to be city workers or military. We have the largest naval base in the world here in Norfolk. We have the Coast Guard. They tend to ride our ferry back and forth because the Coast Guard station is across the water from Norfolk. And so they just park and they jump on the ferry and have a nice little ride over to Portsmouth. So your demographic is really important when you're talking about implementing different technologies. I want to touch on the free fare. I made a note. I even underlined it. See, well, all I do is write it on paper. Everyone's having this huge debate on free fare, that, oh, free fare cures all of our equity issues. Just give it to them free. Well, I'm actually doing a paper on that right now. So I'm kind of undecided, on which way I fall. I'm leaning this way. Because every time we have a free fare day in Hampton Roads, we get a lot of complaints because we have certain people who ride our longest routes from, Newport News through the tunnel, across the bridge into Virginia Beach. They're the housekeepers and the cooks and those individuals who are essential. And they don't like it when we have free fare days. They feel unsafe. We have an issue with our homeless population getting on board, trying to get out of the elements. It creates confrontations with our drivers and our other passengers. So when we talk about doing free fare, I keep saying it's a much bigger problem than transportation. If you go to our customer service, the director of customer service and myself, we work really well together. The number one complaint is service. Number two is cleanliness. 3, rude bus driver. Our rate is like below number 5. Even though we have this huge 90% of lower income people, that's not their biggest complaint. Their biggest complaint is we don't show up on time or we don't show up at all, and we're short bus drivers. So those are the things I keep saying, fix the problem. Equity in transit starts with routes. It doesn't start with fares. It starts with routes. Are we accessible to those individuals who need transit? Because I forget who said it. Maybe it was Dr. Wall. Accessibility is so key. And if you don't have accessibility to transit, it's a domino effect into all the other public sectors, into healthcare. COVID actually exposed that we haven't had equality and equity in transit. We thought we did, but COVID said, no, you don't. Guess what? It's all been covered up. Because if you look at the statistics, more African Americans, lower income, died from COVID than anyone else. Look at it. And it's the access to transportation. There's higher ER visits, there's higher chronic illnesses, and that's because of the access to healthcare. You can't get an education. You can't get better housing. You can't get better jobs if you don't have access to transportation. It's not giving it to them free. I think one of the key things that we need to do is partner with, there has to be this cross-sector, multi-sector collaboration going on. It can't be us in our own little silos. And we have to address the bigger issue of homelessness. It's not the issue of homelessness, homeless people not being able to get on the bus. It's, well, why are they homeless in the first place? Why don't we address that issue and then work on the transportation? But we also have to partner with the health services. I worked with all the emergency management systems across all 6 cities during the height of our pandemic, because we were offering free tickets to those organizations to go give with the outreach groups, to knock on the doors, to make sure that individuals who wanted to go get a vaccination had transportation to a vaccination clinic. We gave 2 go one day tickets. You could ride all day long. I didn't care where you went, as long as 2 of those stops were to the vaccination clinic and home, you could ride all day. And so I got to go to the emergency management, and that, goes into a whole other issue of equity when there is a disaster. Those individuals having accessibility to transit is a huge issue. Free fare is not the answer to it, in my opinion. But again, I'm still writing the paper, but I'm pretty sure that's going to be the ending of it.
We're going to look forward to reading the paper and making sure that gets socialized out. before we go to Dr. Wall, I think that really, what all of you have sort of, come to in terms of the overall fundamental, it's that mobility is a human right. It is, access to transit is fundamental to everything we do. And I think that, Sheri, to your point, COVID really exposed the reliance. Bless you, Amanda. It exposed that reliance on being able to access services and knowing that you were going to be able to, do your job, whether it was stocking shelves at a grocery store or, being a ER doctor, in one of the LA hospitals or San Diego hospitals. Whether it was, being a key food service provider at a manufacturing facility, in some of our rural communities. It is a fundamental right. And I think that all of us together are working towards, through these discussions and some of the programs are working towards that. I want to pass it back to Dr. Wall for that broader perspective. You got us on the accessibility topic, which was awesome. And you had your hand up following Sheri and Carol's comments.
So one of the things that's really interesting listening to everybody speak is something that I see in the DEI movement, regardless of what industry we're looking at, right? Which is there's a ton of reactivity. There's a ton of, oh my goodness, there's a problem. Look at this problem. We should do something about the problem. What can we do? And people throw out ideas. And I'm reading the chat, and like every idea on the surface looks really great. But the question we have to start asking ourselves is, are these the real solutions to the problems that exist, right? Sheri was going back, is giving free fares going to really solve the issue of homeless people needing shelter, which is part of the reason they want to get into public transport. Like, it's warm. Here in San Diego, things are pretty nice, but I think about being in Paris in the winter. It is cold. New York in the winter is cold. Boston is cold, right? So that's not going to solve the larger issue. And so if you are heading or DEI programs in your organization, if you are part of committees, really resist the urge to want to reactively respond to what you think are the problems you need to solve. And that is where all of you spoke about really surveying as best as you could. Carol, you're like, well, sometimes we just miss a demographic. Like, we think we're doing our job, but we miss a portion of people, right? But really continuing not only to survey the users, but then to make sure that you have, we talk about the value of diversity, like you have a diverse representation of people within your organizations who through inclusion know that they have a voice to talk and to dissent. And the advice that I often give organizations that I work with is you got to think big, but be pragmatic, start small, and take action, right? The goal is do something. This cannot be aspirational. It really is like, think of the biggest problem you can solve. What's the smallest step that you can take to solve that problem? That's a pragmatic step, and then start there, because success in that small action will beget future potential and buy-in. I had a small debate with my husband this morning when I was talking about this, and he was talking about the reactivity that you see in people now when the words equity and inclusion and diversity and justice get uttered, right? And in order to push back to some of that reactivity that we're seeing in people who are just, they feel overwhelmed by this, we have to show that, what we're doing makes a significant difference. And when we make a difference for a small group of people, we actually make positive differences for the whole group. So that's just, my 10,000 foot view on what I've been hearing you talk about.
I love that. And I think it leads us, as we get into the Q&A, it leads us really to, one of the first questions that's in our Q&A, which is it possible to design inclusive and diverse transit systems without having a transit organization that resembles or practices that same diversity and inclusion? And I know that many of the women on the panel and the agencies that you represent, many of the vendors that I see in the chat and in the attendees, as well as Cubic and myself specifically, have taken the Mobility X pledge. How do we get more women into the trans industry? We have a very disparate number of women, for example, that are helping to build and design inclusive transit systems compared to women that are in the medical profession or the legal profession or the retail profession. So I'd love to hear just like a quick speed round, a sentence or two from each of our panelists about how are you designing that inclusive organization for your transit agency, and how does that, how is that being reflected within your organization? What are you doing to get more inclusivity in your agency so that it's then reflected in your planning? And we'll start with Amanda.
Thank you, Bonnie. I think my 10-second spiel on that is look around. Look at what programs you already have and how you can use the partners that you as an agency already have established and take them further, whether it's the social equity listening tour or talking and sharing your apprenticeship programs that you offer as an agency. Around the nation, everyone is having driver shortages. Everyone is having a hard time recruitment. Why wait until we're so far down the road that no one could drive the bus? Start now. Look around at who your partners are, and don't be afraid to include one of the groups that constantly gets left out, the youth. They are the next step. And if they don't believe it now, they're certainly not going to believe it 10 years from now. And then we're really going to have no one to drive the bus.
Awesome. Kyle?
Sure. So in terms of what's happening within Metro, HR, Human Resources Group, with every single new hire or promotion, the diversity around any department or unit is examined. So in terms of looking around, I'm proud to say that I actually work in a diverse space, and we do business with diverse companies who also share those same values. It's apparent in meetings. It doesn't feel awkward when it gets said. That's how you know you're working with the right people. Part of my job is that I oversee all of our top vendors. Those are the mom and pop shops or large retail chain stores who sell our fares to the public, making sure that we are doing business with other minority-owned businesses or small businesses, women-owned businesses. That's really important too. And also back to just looking around as a Black woman, it's awesome to see that I have a Black female CEO to look up to. It's empowering. It confirms that I deserve to be in this space and that I'm valued, and hopefully I'm paying that forward and passing that down. So just that phrase, looking around and seeing, where you are, what environment you're in, and who you're doing business with, that's the biggest step.
I love that. It also reminds me of Hamilton and the look around for any of you that are musical theater fans. So let's go to Carol.
Sure. And I would also just say, Kyle, you also have a Black female vice president. So at MTC, I would say we have created an equity platform. I'm putting that link in the chat right now, but it's not enough to create a platform. You need to develop an understanding of what it means in practice and have the resiliency to know you're going to hit bumps and get some things wrong. I would say we cannot assume we can understand. And I think that's what people are saying when they say, look around. Don't assume that you know what people need. Acknowledge what you don't know and own it when someone corrects you. I would just also point out that all of this takes resources. If we're going out to communities, if we're doing customer research, if we're redesigning programs, it all takes resources. So I would say it would be an empty promise to adopt a platform and not resource it. I would also say look for best practices and people who have experience, because they're out there, and bring in the experts and the people who've been doing this work to help inform the programs and policies and services that we're building. Thanks.
Thank you, Carol. I love that. Paige, over to you.
Yeah, so we do have a new HR person. It's our first time we've had an HR person, and it's been a night and day difference, because they are bringing a perspective to the hiring process and retention process that we have not had before. And I'm really excited about all of the transition that's happening throughout the country and the world. There's so much momentum and mobility within just the job market right now, and how much opportunity there is for being able to hire a more diverse workforce. I'll just leave it at that.
Awesome. Thank you. And Sheri, your thoughts on that?
I think at HRT we're pretty diverse. What I would like to see is that there's more a more diverse group at all levels. You know, I think we tend to see the majority of our minority individuals in our lower, I like to describe it as a pyramid. We're a pyramid. It's this lower foundation of what we do. That's our bus drivers, our servicers, our maintenance. That's where we see the majority of our minority individuals. I would like to see more women. I would like to see more women in director, executive, CEOs. I love that the panel I was on in AFTA, Catherine Kellerman, CEO, I loved it. She's a firecracker if you haven't met her. I loved her. She's like my BFF. She doesn't know it yet, but she is. So I'd like to see more women in more powerful positions. I've said it, we all still work, no offense to any men in the 184, but we do still work in a man's world, especially in transportation. I still get paid less. You know, it's still harder for me to get promoted. It's just a fact. It just is. So that's part of the reason why I woke up one morning and applied to a PhD program, is to help make change. At HRT, I was the first person, proud to say, after a paratransit meeting, hearing someone speak about how hard it was for a paratransit, a person with disability, to one, get a job, and two, if our paratransit services don't pick them up and get them there on time and they get fired, it's even harder for them to get another job. I took one of my full-time money room positions, I converted it into 2 part-time positions that are specifically designated for persons with disabilities. So at HRT, I have the first 2 persons with disabilities hired in my department. And that's, you know, individuals who ride our paratransit services. So I wanted us to not just provide them services, I also thought we should provide them opportunities as well. So I think that's really, really important. But aside from the equity, I think leadership not only within all organizations, within the country has been an issue. And I think leadership is one of the biggest issues that needs to be worked on.
I think that's a great point. And you built on what Carol said about taking action, right? About, you know, really, it's one thing to have a platform. It's another thing to take a position, convert it into those part-time roles, and absolutely put it into action. I agree.
Real quick, I just want to say, I noticed that nowadays the word equity is like the popular, you know, word right now. Everyone's throwing equity around. And I just want people to know, just because you say it, it doesn't matter. If you're not doing something, if you're not making sure or checking, look, go to the transit centers, ride the bus. How about that? Let's ride the bus. Let's ride our own services. Why don't we do that? Why don't we talk to our riders? If you're not doing that, you have no idea whether you're providing equitable services or not. And I think that's key. Don't just throw the word around because it sounds really cool and it's neat. Hey, we're, you know, working on equity. You know, you actually have to be doing something.
I absolutely agree. And I think it's one of the challenges. And one of the challenges as we get to the last couple of minutes here, and we'll answer another question or two from our Q&A. But one of the challenges that I would throw out to all of the amazing women on this panel, I think, Sheri, to your point, and a number of the women have made the point about leadership and about, you know, giving opportunities. Each of us has a tremendous opportunity and a platform to talk about diversity and equity and inclusion, how we bring that to transit. If we're not already out writing services. It's one of the foundational pillars of our business is get out on the buses and trains and ensure that we're understanding what the communities we serve are experiencing. But also the next time that someone calls and says, hey, Sheri, do you want to be on a panel? Let's all nominate. I've got my person already identified, amazing program director from our Chicago office, who I've said, hey, the next time I get asked to moderate a panel, I'd like you to be the moderator, because we also need to be giving those opportunities right out to other women in our organizations, so that we can continue to expand and give voice and an opportunity to people of color, people with disabilities, with different learning styles, and sort of that neurodiversity, which we don't really get to talk about. And I know Dr. Wall probably has another hour we could talk about neurodiversity and in transit and how that plays out. But I want to wrap up with a final question that I'd like everyone to contemplate. So as we think about equity and inclusion in transit, we've talked about some of the unique programs that each of the different agencies have been putting forward to create a more equitable system, how you're addressing the debate that's going on around free fares, around some of the housing challenges, around bringing more inclusion and equity into your own transit agency organizations. What is one key takeaway from each of you? And it can be specific to your agency, or it can be for you personally, that you would like all of the attendees that have been participating in the great discussion in our chat to have. And I'm going to start with Carol, and then we'll just do a quick round robin. So the key takeaway that you want in the discussion to have from you about equity and inclusion in transit today.
Keep going, keep learning, don't give up, even when it's hard. I guess, we don't know what's good enough, unlike the Americans with Disabilities Act, which set out some very specific mandates that had to be met. In this space, we don't have that. So I would say, let's keep going forward and keep learning. And probably I'm going to benefit from others who had a minute to think about it now. But don't give up. Don't let it be just the fleeting commitment of the moment.
Love it. Amanda.
Yeah, I love that, Carol. Very similar testament that you don't know what you don't know, and you don't know what you don't know by not listening to those who are really who you're trying to serve. So reach out to your community, dig deeper, and really get to the core of what we as an industry are supposed to be doing, and think about whether or not we're doing that for everyone that we're intending to serve.
Awesome. Thank you, Amanda. Kyle?
I agree with those comments, definitely. I would also add, oftentimes starting a new project, especially within a government agency, can be overwhelming. There's procurements, contracts, figuring out funding, everything. I would say don't be overwhelmed by it. Initiate pilot programs. Build in phased approaches to big projects so that you can get some small wins along the way and show that this is successful. And then I would also say, continue interacting with customers. And that goes beyond a survey. Get out there in the spirit of writing the system, get out there, talk to customers, talk to people who work with customers, stay in contact with the front line. All of that will improve the thinking and planning in-house.
Awesome. Sheri?
You already know what I'm going to say. Know your riders. That's
Easy.
it. Know your riders, know your region, know your demographic. And I don't mean just know it on a piece of paper, because like I said, numbers aren't always, they're only as truthful as the person who did them or how they relate to your organization. Know your demographic, not just for the region, but by mode. It's really important to know who your riders are. Like Kyle said, you got to get out there. And I think that's not just our riders. I think you know, from a internal perspective, you need to know your team. You need to know your team and the other person's team and everybody's team. And you need to know everybody internally and externally. So, and then get out there and go to the customer service centers, ride the bus, ride the trolley, talk to the people, ask them. They'll tell you, trust me, they're very honest here in Hampton Roads. They'll see my badge, they'll tell me she just looks like she's somebody, and they'll just start telling me what they like or what they don't like. So, but that's how I know. I start taking notes. Know who your riders are.
Know your riders. Paige?
Yeah, similar to what all of these wonderful women have already contributed. I'm a big supporter of wraparound services and the 211 type of database and networking, and realizing that accessing transit is just one doorway often into being able to access a lot of other human service agencies and programs that we have in our community, and vice versa. I stay in my lane often with transit. I know it really well. And I also know that I don't understand rental assistance and utility assistance and finding shelters for homeless, and all mentoring for youth. There's a whole other wonderful group of human service agencies that are in each of our communities, and oftentimes they come through their door needing transportation. And so making sure that we have that wraparound services that's strong and can be supported in our communities, so that we're doing more than just providing a ride. We're doing a livability assessment and trying to make sure that everyone can achieve everything that they can in their life.
That's awesome. And the final word from Dr. Wall.
Be responsive, not reactive. Think big, but be pragmatic. Start small. Take action.
I love it. This has been an incredible discussion. I want to thank all of our panelists. I want to thank Global Mass Transit for putting the webinar on today. There's been a lot of discussions and documents shared. Take action, think big, know your communities, get out there and ride the buses, the trains, the ferries. And we will look forward to continuing the conversation. Thank you from Cubic and myself at UMO Mobility. We're looking forward to the next discussion. And I hope everyone has a great rest of your morning, afternoon, or evening, wherever this finds you. So thank you so much for participating today.